Hello, and welcome back to the SBDN podcast and to the second episode where we want to shine the spotlight of some incredible people in our dental community. And today we've got a real treat for you. It's the one, the only Mrs. Jocelyn Harding, aka Joss. From starting out as a dental nurse in the Royal Navy to becoming an award-winning dental hygienist, a published author, president-elect for the Mouth Cancer Foundation, and an international voice in oral healthcare. Have I missed anything out, Joss?
That sounds wonderful. Thank you so much for bigging me up. I sound amazing.
You are amazing. And obviously, I know how amazing you are, as you are my dear friend. So I want everybody else to hear about the amazing career that you've had and how you're trailblazing at the moment in this community. Like, it's amazing. Like, I tell everybody about you, so I want everybody at the SBDN to hear about you too. So how are you, Joss?
I'm very well, thank you very much. Yes, getting excited because the dental show is on next weekend. So rock and roll Friday and Saturday. So I'm up there speaking on the Friday, and then I'm going to be back up there on the Saturday because I want to catch up with colleagues. And I've got a dear friend from the charity who's going to be speaking. I want to support her as well. So yeah,
Busy. Excellent. So you're going to be speaking on all of those days?
No, just the Friday morning they've got me on, which is fabulous. And then later on in June, I'm speaking to Cancer Research UK. I'm speaking to British Association of Head and Neck Oncology Nurses. I'm speaking to local oncology staff at Gloucester Royal. And, you know, every opportunity, I'm a bit rubbish, as you know, Cheryl, a bit rubbish at saying no, really.
She's just a girl that can't say no. And we love you for it, Joss, honestly. So I've got a lot of questions for you. I put out on all of our socials any questions that anybody would like to ask you. So I'm going to fire straight in.
Okay.
Let's go back to the beginning. What was Joss like at school?
Oh, I think I was, wow. I love my sport. I really enjoyed my sport. I always enjoyed hockey. That was my love at school. I think I was better at sciences than I was at English language and things like that. And as I've told many people, it took me 3 goes to get my English O level. So to be writing as I am now, it's a bit of a learning curve. And I feel sorry for the people around me that are reviewing my work, but very grateful for them too. But yeah, actually where this all started was when I did my work experience when I was 15, as a lot of us have the opportunity to do. And a friend of mine said, I'm going to do dental experience across the road at the practice. And I was like, oh, well, I might as well give it a go. And that's where I met Becky. And Becky was a dental hygienist. She's just served 9 years in the Navy. And I thought, that sounds amazing. And I've kept in touch with Becky, throughout my career. And she's retired now, and I managed to see her the week that she retired when I visited back home. And I keep telling her it's her fault, you know, all of this is her fault. And she sowed the seed. So that's where it went. And I went back to that practice to see if they'd employ me as a dental nurse, a trainee, when I left school. And they said yes. And then they said no, they didn't have time to train me. So I had a few other jobs. But, you know, funny things happen, don't they? And I put my name down to join the Navy.
Right.
They said, go away for 2 years. You're not going to get, you know, your name's not going to be pulled out the bag. You know, it's going to be at least 2 years. So off I toddled and went off, and I worked as a junior in a solicitor's office. I went to work in the land registry. So I saw the other side of conveyancing. So all of that was great experience. And and then I got a phone call and they're like, Joss, are you sitting down? I said, yes. And they said, well, you're in. You got 2 weeks notice. And that's where
why the Navy? What made you want to join the Navy?
I think partly, Becky, I didn't have any family that had been part of the military lifestyle. So I didn't have any of that experience. Didn't have any friends that had joined up. So I don't know. I think it's probably Becky that sowed that seed. And when I started sort of looking into what I could do, you know, and the different branches that they were and different experiences, then, it just ticked all the boxes for me.
So what was training like as a dental nurse back? What was dental nurse training like?
Oh, do you know what? It was very different. So we had our basics training down in Plymouth, and that was only a few weeks. We sort of square bash, really. learned how to work as a team, were made very fit. So we were running and walking everywhere, really getting the team ethos into our head. So for us as dental people, that was really important because we
Yeah.
always have to work as a team. So I've always worked as a team from the get-go, really. And then
Yeah.
I went to do my dental nurse training at HMS Nelson in Portsmouth, and the training was only 6 weeks long. So it was a real quick introduction to dentistry. And then
Yeah.
really we learned on the job. So it was more like an apprenticeship then. So then we were out and I was up in Scotland with a dear friend of mine, Nicola Tong, who I'm still good friends with. I was 19, she was 17, and we were up in Scotland at the submarine base. So that's where it all started there, really.
So what's your highlights from that training time when you were young and the world was your oyster? What are those standout highlights for you?
It was so good because with the forces you get to work with a lot of people and they're moving around, you're moving around, so that's really, really good. So I was being winched out of helicopters, I went onto submarines at 4 o'clock in the morning, you know, and discontamination and cross-infection was very different then. So we
Yeah, I
used to
bet.
take, a tub of Hibby scrub and a handful of mirrors, and they sort of soaked in this stuff as we were doing dental checks, or the dentists were doing the dental checks. We were just doing the charting. So that was really good times. I learnt to ski. I think it cost me £50. That covered the hire of the skis, the accommodation, the food. So, there was lots of perks, it was really good fun.
Yeah.
Really good
Oh,
fun.
wow. Do you think it's changed much?
Oh,
As in
definitely.
training in the Navy, like is the pathway still the same now? Or, if there's anyone out there that wanted to train now through the Navy, is that still a pathway?
So I know they still recruit for dental hygienists. I've seen them at the stands in the dental show. So they're still recruiting for dental hygienists. I don't know about dental nurses. That I don't
Mm.
know. So I wouldn't like to say anything wrong there. So I'm not sure. So yeah, but it was good fun. It was really good experience. I met some amazing people, still in touch with lots of people. We had a reunion a few years ago in Portsmouth, obviously. And
Yeah.
it was great. Bit of my heart's in Portsmouth, really.
Oh, so you've worked in a lot of countries, right? So Gibraltar, Hong Kong, Hawaii. What's your favourite and
Oh
why?
gosh. So I know, I'm so lucky. So Gibraltar, I was working as a dental nurse. So there we were working in a very small clinic. We did the oral surgery. So we went to theatre every week. We did the orthodontics for the children and the families that were serving there. Hong Kong, I was qualified as a dental hygienist there. So they were very different. I loved it. And Hawaii was a very lucky I'll go there. So they chose nine
All
service people
right.
from all this. I know it was awful. Honestly, it was awful. No, it was great. It was absolutely lovely, absolutely brilliant. We're on the island Oahu, and we were very well looked after by the team that were there. They looked after us well.
Yeah. Oh, wow.
Yeah,
So
really
what
good.
made you want to transition from being a dental nurse to a hygienist? Where did that start?
That really started right at the very beginning when I saw what Becky could do, and she
Mm,
worked with a dental nurse then, which was unusual. Um, Yeah,
yeah, back
really
then.
unusual. She was lucky in her clinic and kind of sowed the seed for what I could do to help improve oral hygiene for patients. It was that communication skills, working alongside a team. I mean, it
Yeah.
just ticked all the boxes for me. And I just wanted to spread my wings a bit, really. I
Yeah.
really, really enjoyed my time as a dental nurse. I thoroughly enjoyed it.
What advice would you give to any dental nurses that now wanted to progress into dental hygiene? It's a lot
Go and
harder now, isn't it?
Yes, it is. It is. However, I think with the apprenticeship schemes that are going to come on, I think it's going to be
I,
really exciting. And I
yes,
think
I
it's
was
really,
picking at that the other day. I was like, oh, what is this? But no one seemed to know a lot about it to give me any like input on it.
the person you need to speak to about that is Mr. Mike Wheeler, an incredible
Right,
guy.
writing that down.
You need to speak to him. He will tell
All
you
right.
all about the apprenticeship and how much he's
Yeah,
pushing for that and developing it.
yeah.
I think it's going to be great because I think I personally think really good hygienists have been really good dental nurses first. I think they know how to
Yeah, yeah,
communicate
yeah,
with
yeah,
their
yeah.
patients. They know the patter. They know how to look after patients from the
Mm,
moment they bring them in from the waiting room. I personally think it's the best way. So I think
yeah,
that apprenticeship will help a lot of people who haven't necessarily got the academic
yeah,
qualifications, but really it's about
yeah.
communication. It's being able to talk to
Of
our
course.
patients and help understand them to understand what we do. And yeah, I think it will be really good. It'll open up lots of doors for lots of people.
Yeah, yeah, because it's such a big barrier, isn't there, for like, well, somebody like me that I've got a family, I can't just give up work and go to university for 2 years. So financially, so it's just something that I just had to box essentially. But then I'm hearing all of this like exciting things about apprenticeships and stuff, which makes it so much more accessible and reachable to people like me.
Everybody, I think it's great.
Yeah,
Absolutely
yeah.
brilliant. I think definitely the way ahead. So yeah, watch this
Mm.
space. People keep your eyes.
Ah,
Yeah, keep sitting
yeah,
in with
yeah,
hygienists, different hygienists. We've all got our different pattern. We've all got a different way of looking after
yeah, yeah, yeah,
patients.
yeah,
We've all learnt at different universities or schools.
yeah,
So we've all got different ways of looking after and caring up for our
yeah,
patients.
yeah, 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 yeah. If you could go back to speak to yourself as a newly qualified hygienist, what would you tell yourself then that you know more about now? Would you change
Something
anything, Joss?
I was pulled up on a national stage when I said I was just a dental hygienist. They were like,
Oh,
So now I'm always saying that to others. Please don't say that you're just this or just that.
yeah,
You're
yeah,
not
yeah, yeah,
just. So I would say I wasn't just a dental nurse. I wasn't just a dental hygienist. It's really important that we value ourselves. We value our relationships with our professional relationships with our dental colleagues, with our medical colleagues. You know,
yeah,
I would say don't take no for an answer. So, at the beginning when I was looking at how to look after cancer patients and
yeah.
develop the book and go for my master's, I never thought that would ever be me, ever. So all my
Wow.
friends now say, well, you can't say you're not an academic now because you've got your master's. And I am so
Yeah,
proud of
it's
it.
official.
But I
Yeah,
loved it. I loved it. I found the right course for me and I had the right
yeah,
tutors and the people that really nurtured me. They had a hard
mm,
job, but it was really well worth it. So I'd always say, go for it. You'll meet crossroads
yeah,
people, people who will help you on your journey. And
yeah.
you'll ask the questions and they will give you that little push, such as the lovely lady that we both know, Dr. Eva Rosvadowska. So she was
Yay.
definitely my crossroads person and probably yours
Mm.
as well, Cheryl.
Yeah, yeah, absolutely, absolutely. Things happen for a reason, though, don't they? Like people come into your lives and just randomly, or and how can make such an impact and influence decisions you make.
Yeah.
Yeah, and as you're a massive like influence to me, honestly.
Oh,
Yeah, we've known each other a long time now, Joss. Lots
we
of stories we could tell, but not on here, right?
Yeah, we've helped each other. We've done a lot for each other.
Absolutely,
You certainly have
absolutely.
helped me as well. So,
Oh,
take the
I
credit there
think one
too.
of one of the highlights is obviously that night where you won hygienist of the year. I
Oh,
mean, oh my gosh. Like we all knew how amazing you were, but the fact that everybody now knows how amazing Jocelyn Harding is was just like we were all
mm.
so proud of you. Honestly, it was such a lovely night. So tell us, Joss, what was the journey leading up to that moment?
So it was an incredible night, wasn't it? So what happened
It was a good night.
was back in 2016, I was noticing more patients come into the practice who'd had a cancer diagnosis. And what they were telling me was how awful their mouths were during that journey. And I was thinking, gosh, surely this should be improved. Why are the medical professionals telling them that they can eat and drink whatever they want during the day? Well, don't they realise the damage that's going to happen to their teeth? And then these people have got to have all these repairs done and it's going to cost them to get things sorted after treatment when they come
Mm.
back to me. So I started asking more and more questions and I went to a dental show and there was a restorative specialist who happened to be from Gloucester Hospital who was talking about head and neck cancer patients specifically, and she was talking about how to look after them. But by then I'd actually collected a lot of dry mouth products. I'd asked lots of questions about about them? Were they evidence-based? Which I didn't really understand at the time, but I do understand now. I was asking about what the ingredients were, the pH was, different things like that. I had all this information and I didn't know where to put it. So I spoke to this professional afterwards and I said, I've got this idea for a leaflet, maybe I could put this, because as you know, we were very good at creating lots of leaflets in the practice for our patients.
Yeah,
And
absolutely.
they need go-tos, don't they? Just easy pick-up things. I mean,
Yeah,
now
yeah,
we'd
yeah.
email the information now, wouldn't we?
Exactly. Yeah. Bit old school now, a leaflet, isn't it?
Nothing wrong with a bit of paper, but we try and reduce it as
I
much as
love a bit of
possible
paper.
now.
I love a bit of paper, me.
So this the professional said, well, you can't create a leaflet. It's got to be evidence-based.
Yeah,
But you can go and
absolutely.
write an article. And that was me. Obviously, as I mentioned, it took me 3 goes to get my English O-level. So
Yeah.
that wasn't going to come easy. So I went back to the practice and I spoke to Eva and I said, I've been told I need to do this. And rather than her saying, oh dear, she said, come on then, let's get it together. Let's help you.
Of
So she
course she
really
did.
supported me. Yeah, amazing. And as you know, we met with and we worked with Megan Thomas, who had the charity
Yeah.
Brush Up UK. And so this all seemed to come together. And Megan
Mm,
and her husband created the most wonderful leaflet. And so that came out in 2018. And then it's been updated since with various
yeah.
ideas, things that people have as go-tos for their mouths, not just for head and neck cancer, but for any cancer treatment. Because as we know, a lot of people
Yeah.
suffer with a lot of side effects. And if you can help their mouths just be that little bit easier to cope with or for
Yeah.
some of the journey, then hopefully that will help them out. But yeah, so that's where that started.
Amazing. Oh my goodness. And it just
Crazy.
flew from there, isn't it? Um, so that also led to this marvelous book that I know is in the surgery I work at now, and I talk about it all the time. And it's an amazing peer review book, Joss. Like, how did this come about? Like, it's World Book Day favourite now, isn't it?
So this was another idea. So at the hospital I was working at Gloucester, I started in January 2020. And as you know, we went into lockdown in March 2020. So I used to park my car at work and I used to used to park my car at my friend's and then I'd walk to the hospital. And on the way, I'd be listening to things and I'd be having ideas and things like that, how to help my patients. And I don't like to sit idly. So I thought, why don't we set up another leaflet? So I'd already created a Facebook group for hygienists and therapists and other dental professionals working in Max Facts with head and neck cancer patients. So I thought, why don't we all pick a topic? Because the problem is when we come into working into the hospital environment, we have no extra training. And I think that's poor for the patients and I think that's poor for ourselves because we are caring people, we're empathetic people, we want to do the best for our patients.
Yeah.
So I thought, what about a leaflet? So everybody, I said, pick a topic, find a professional that knows more about that topic and then create a PDF so it can be updated. And it's just to help people to sort of understand the journey of head and neck cancer patients.
Yeah.
So this kind of grew legs because we started off with 15 topics. And then I spoke to Eva about it and she said, this is a really good idea. I think I need to connect you with Dr. Janine Brooks, who's a very well-known lady who's done a lot of books. So she
Yeah.
looked at the idea. She said it was really good. And she said, I'm going to connect you with Wiley. So Wiley, the publishers, they have to look at what is already out there on the market. So they're like, oh, sounds a good idea, but we need to check what's out there. So they
Yeah.
sent off the information and they said, about 4-6 weeks, you might hear back. So they came back very quickly and they said, there isn't anything out there like this. Are you happy to go ahead and publish? I've never
Yeah.
published a book. Of course, yeah. What could go
Of
wrong?
course,
What could go wrong? So everything got legs then. So from those particular topics, I said to people, what other topic do you think you would like in the book? So then
yeah.
these people were connecting with more and more people, and so was I. So we ended up with 49 chapters, with 56 contributors, with me emailing them at the weirdest time of the world going, hi, we haven't met, but would you mind writing a chapter for my book, please? I don't want a master's piece. I'd just like a piece people can
Yeah.
just pick up and understand about that topic. Is
Yeah.
that okay? So that's how it kind of came about. So,
Wow.
yeah, crazy. So
Gosh.
the book's been reviewed. It's been sold all over the world. It's made so far £3,200 for charity. It's been reviewed in Australia, New Zealand, and America. The reviews have been amazing. The one comment that's been made is that the title is wrong, and I agree, because at the
Okay.
beginning, I wanted it to be care of head and neck cancer patients. And the
Right.
publishers wanted something a bit more niche. So I said, what about
Right.
for dental and medical professionals? They're like, no. What about dental professionals? No. So I said, well, dental hygienists, dental therapists. Oh, yes, that sounds good. But all the reviewers have
Right.
said, actually, this could be for any medical and dental professional to pick up, to understand about that particular
Yeah.
topic for any cancer patient, to be fair. There are
Mm.
lots of specifics in there for head and neck. But
Which is
actually,
what you wanted, wasn't it? For
yeah,
everybody.
yeah.
Yeah.
So yeah, just absolutely amazed. Oh,
So
absolutely
is there going
amazed.
to be book number 2?
Not that I
Eh?
can
Eh?
see at the moment, but there are topics that could still go in there at the next one, as these things
Uh-huh.
do. They should progress. And if somebody else picks it up and says, Joss, this is brilliant, but what about if we because things will be updated. There's more and more therapies coming along, so
Yeah.
it will need updating, whether it's me or the
Yeah.
next person who I don't mind at all. I mean, it's just having something out there that wasn't there before
Yeah.
that I needed, and these
Yeah.
patients needed. So yeah, it's really interesting where it's gone. But yeah.
Gosh. So tell us about the Mouth Cancer Foundation. How did that collaboration come around?
So in 2018, I met with the United Kingdom Oral Management and Cancer Care Group, UCOMIC, and Emma Riley, who's part of SBDN. She was a
Yeah.
dental professional right at the beginning. And then when I joined, there wasn't a dental professional involved. So then it was me. And I met some great medical and dental professionals there. But also at the same time, the following day in London, I met with the Mouth Cancer Foundation, and they invited me to become a clinical ambassador, which is just fantastic. Mouth Cancer Foundation is the longest running head and neck cancer charity in the UK. It's our 20th year this year.
Ah.
I know, amazing. Set up by Vinod Joshi, a restorative specialist from London, who wanted to help and support patients, because it's all very well us learning all about the academic stuff, but it's about the real life, ongoing
Absolutely.
things and problems, late
Yeah.
effects, side effects for our head and neck cancer patients, and their
Yeah.
reviews and the support with their caregivers and their families and friends. So the Mouth Cancer Foundation was born, and yes, I came along in 2018. So I'm delighted to be part of the charity. It's a great charity. And
Isn't it? It is. Absolutely. I mean, I
excuse me.
direct a lot of our patients flying the Joss flag wherever I go.
Thank you.
But yeah, directing them because it's such a great website. It's information for clinical and non-clinical, and the feedback's been amazing from quite recently a patient that thanked me for directing them that way, because it's just information that they wouldn't have had, that they didn't get from their GP or aftercare. You're just left to fend on our own essentially. I was like, go check out this website, honestly.
Oh, thank you. They
Yeah,
work really
amazing.
hard. They work really
Yeah,
hard on
yeah,
all the downloads, the leaflets. People can
yeah,
connect with the charity, and they will send them leaflets and booklets and posters, or you can
yeah, yeah,
download and print yourselves. Excuse
yeah,
me. Excuse me. But yeah, it's a great charity, And now there's a Facebook group, and we have a Monday
yeah,
night Zoom, which started in lockdown on a Monday evening from Monday from 7 till 9. It's run by Karen Leishin Schroeder. She's a fantastic patient herself,
yeah,
9 years post-treatment. So yeah, it's lovely
yeah.
to help and support, because these
It's real
people.
stories, isn't it? Like, it's ran by people with real stories that have that information to give firsthand, which is gold dust, really, isn't it, to patients that are now, if they sadly have to start that journey,
Mm,
like to hear real stories and advice that may help somebody, like that's gold dust, isn't it?
It is. And I think it
Yeah.
helps professionals to understand what a brutal
Yeah.
journey it is
Yeah. Yeah.
and how
Yeah.
important it is to do head and neck
Yeah.
cancer screenings, how important it
Yeah.
is
Yeah.
to ask people if they're smoking or if they're drinking alcohol. Do they need any
Yeah.
support? Do they need signposting? Do we talk about
Yeah.
HPV? I talk about HPV with every patient. They may not be aware that
Absolutely.
their grandchildren have had vaccinations or have their
Yeah.
sons missed out on the vaccinations.
Mm.
In Europe, we are the lowest. So sorry.
That's right.
Choky. We are the lowest number of uptake of the HPV vaccination post-COVID. So before
Why do you
COVID,
think that is?
so I'm hoping it's not because people are steering clear of vaccinations, because the research is very good for the HPV
Yeah.
vaccination. It's been around for many, many years. It not
Yeah.
only reduced the risk of cervical cancer, it's for head and neck cancer, penile cancer, and anal
Yeah.
cancer. It's reduced cervical cancer by 87% so far.
Mm.
So the hope in 20 to 30 years' time, potentially, a lot of these cancers will be eradicated. So
Yeah.
I'm
Yeah.
always talking about HPV, and people automatically assume, because the girls have been vaccinated since 2008,
Yeah.
they think that it's for cervical cancer only, and really the boys should have been vaccinated at the same time. So
Yeah. Yeah.
it's catching everybody. So I don't
Mm.
know. It may
Yeah.
be.
There's a couple of my friends that are like, they won't have let their daughters have it done, and I'm like, it might do, yeah, 100%. Obviously, got the proper information, but yeah, and I just think, why wouldn't you? Why it's like, why wouldn't you?
I,
Bonkers.
I think some people see it as encouraging their children to be promiscuous, but it's not. It's about being
Yeah.
honest and frank, and
Mm.
anything can happen anywhere, anytime. And
Yeah.
most of us are walking around with HPV. My smears have come
Yeah.
up
Yeah.
positive for donkey's years, and this time it was
Mm.
negative. So, ooh, it's
Yeah.
cleared my system. But it doesn't mean anything other than it's a virus. They think it's a sexually transmitted disease.
Yeah.
It's not a
Some
disease, it's a
stigma to it.
virus.
Yeah. Yeah.
Yeah. So the more that we talk about it and the more that we raise
Yeah.
awareness, I'm hoping
Yeah.
those numbers will come back up to the same as the other countries in Europe. So we
Yeah.
shall see.
And in a dental environment, it's the ideal place to talk about it, isn't it? I know some dentists probably wouldn't feel comfortable.
Yeah.
I mean, they do the cancer checks, but
Mm.
that conversation,
Yeah.
I know some dentists that they just wouldn't, just purely because it's can be awkward, can't it?
And it can
Especially
be
as a man,
time as
like,
well. Well, yeah, and it
yeah,
can be time as well. So
yeah,
so if people are worried about talking about it, I would say go to the Mouth Cancer Foundation or any head and neck cancer
yeah,
charity
yeah, yeah,
website. There will always generally be leaflets and information on there about HPV. They can always send links to that. But also with Rod
yeah,
Gilbert, the comedian who had head and neck
yeah,
cancer treatment and did his
yeah,
documentary, he mentions in there and he goes, "What? You mean there's a vaccination that could have prevented this?" You know,
yeah,
and
yeah, yeah.
I love that comment because I'm like, yes, there is, and people need to
There
talk
is
about it and why more. So yeah, interesting.
absolutely, yeah, very, 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 very. So, what are you working on at the moment? What's next on your bucket list?
Bucket list, wow.
Ray?
So I'm loving connecting with medical professionals. For me, that
Mm,
is just fantastic because a lot of them know that patients going through a cancer journey or a head and neck cancer journey, they know their mouths are affected, but they don't know what to do. So the Royal
right.
College of Surgeons England are working on an update for the oncology guidelines. UCOMIC are working on on our update for mouth care for cancer patients, and also SDCEP. Have got an oncology guidelines in development. So there's a lot of really good stuff that's going to come out very shortly. So watch this space, I'd say. For me, yeah, I'm
Yeah,
just beating the drum, working for the Mouth Cancer Foundation and just raising awareness, really. So, yeah, loving it.
brilliant. Oh, Joss, honestly, thank you so much for today. Like, I feel like we could talk for hours and hours and
Absolutely.
hours about your amazing career. And what do you hope, looking ahead, your legacy will be in the dental profession? You know, when you're at home in your 80s, sat there with Steve,
Yes.
um, what what do you want your legacy to be?
So what I would like is the black hole that's between when people have finished their cancer treatment and come to the dental clinics, I would like them to know when they can come and see us, because either they're
Yeah.
coming in treatment when we can't necessarily see them. We don't know what their blood counts are. We don't know if we can put their hands on. They're passionate about coming back. They know how important their oral hygiene is and how they want to get their mouths back together. For me, if there's more collaboration between oncology and the dental profession, that will warm my heart. However it comes about, whether it's anything that I've instigated or not, which would be amazing, but even if it's not, if that gap is closed and we are part of that cancer journey and considered for ongoing care, that would be brilliant. Yeah, that'd be it.
Absolutely. Amazing. I know the SBDN, we were having discussions about how dental nurses can help, given the right advice and the training for us to have the confidence to be able to see a patient if they're under treatment at the time. Obviously,
Yeah.
dentists can't intervene anywhere, but just to have that 20 minutes, half an hour with a dental nurse who can have that confidence to talk about products, to talk about advice, and just be an ear to listen to. I know we have our little packs now with at my practice with samples in, and luckily I've learned from the best. So to have that confidence to have a conversation with a patient, and it's like they're so appreciative of it, even though I've done nothing but talk
It
and
means so
listen.
much.
Sometimes that's all patients need, isn't it? So
And
what
sometimes
advice would you? Yeah,
sometimes that's all they've got time for, because if they've got
yeah,
treatment starting, they may be starting the next day or 2 days
mm-hmm.
later, or they might ring the
Yeah,
practice and cancel their appointment. And if you're able to say, oh no, if you could come in just for a chat,
mm-hmm.
just so we can make sure you've got some products, make sure you've got the right
Yeah,
toothpaste, make sure you've got a nice toothbrush or recommendations, just
mm-hmm.
be confident. Absolutely. I think that 10 minutes with a dental nurse will be
Yeah,
absolutely so valuable. They will
yeah, yeah,
appreciate you,
yeah,
and they will come back to your practice and they will be super grateful. So yeah,
absolutely.
no problem.
So what advice would you give to dental nurses that may not feel comfortable in doing that? If they've been told that they have to and they don't feel comfortable with it, like what advice would you give to them?
So connect with me or connect with Emma Riley, have a good chat and say, look, how can I bring this into practice that I feel confident enough to do it? Have a little spiel, have your little go-to conversation that you can have. So you're not going outside of what you're uncomfortable about. Make sure you're comfortable about the conversation. And if it's somebody that a patient that's come back to you that it's an easy conversation. It's a sad
Yeah,
conversation because they're about to start their journey, but they know that
yeah,
their oral hygiene is priority. So just be confident. You can't really say anything wrong. And all you have to say, if you give them the products, is to say, please check with your oncology staff that this is okay,
yeah, yeah,
And if they've turned up, don't turn them away. Give them a cup of tea, have a chat with
yeah.
them. If you've got some products, even better,
Yeah, yeah, yeah. Brilliant. And there's so much out there now, isn't there? I know since
Mm.
you started to have all our drawers full of samples, and there's so much more out there now. And some companies are really great that they will send samples, like Oralieve are amazing, and
Yeah.
Dr. Hef and Peppersmith and all those other amazing companies that are so generous to send us products out for, and Xylomelt's another one. Just to give to patients to try. And as you said, not it's just finding what's going to suit them. And if we've got a little selection to give to them,
Mm.
it's yeah,
It's going to be so important, because especially if, say, a patient starting their journey, they might not have seen a dentist for a little while,
yeah,
So
yeah, yeah,
there's a whole thing behind why they don't come anyway. But if you're able to give them that support as a dental nurse, I think that will be
yeah.
amazing.
Absolutely. Yeah, that's good feedback, I think, to take to the team.
Yeah.
Thank you so much, Joss. Honestly, really appreciate your time. I know you're a super busy lady. So
Thank
if
you.
anybody wants to find out more about you, where can we find you on the socials?
So find me on Instagram, Floss Joss. Find me on Facebook, Jocelyn Harding, Dental Hygienist. Find me on Twitter or X. I'm not on TikTok yet, and I'm not on LinkedIn yet.
Why? SBDNR now.
I'm working on it.
I need to see you twerking on there on TikTok.
That's a step too far, Cheryl. Bless
Brilliant.
you. Yeah, thank you
Excellent.
so
Oh,
much.
you are so welcome. And I hope everyone's that's listened today, please do drop us a comment about the episode. Really love to hear the feedback. If you're not following our podcast already, why not? We're on Spotify, we're on Apple Podcast, and we are also on YouTube if you want to go and watch us over there. And we do little drops on TikTok as well. So please do connect. We really love to hear all your feedback and comments. So from me, it's a goodbye. And Joss,
Thank you very
thank you so
much.
much. And we'll see you doing some wonderful things from afar.
Thank you. Thank you. Thank
Love
you.
you.
Take care. Bye-bye.
Bye.